Hi, I'm Dr. Luke Henry. I'm a chiropractic physician in private practice in Greenville, South Carolina, and I'm at the University of Massachusetts Amherst at the 14th Annual International Conference on Dose Response, Preconditioning in Biology and Medicine. And I am presenting a poster. The topic of my poster is low-level laser therapy for neuromusculoskeletal conditions. And what I've done is do a mini review of the literature to look at the conditions that laser can help. Now, in my practice, I commonly use low-level laser, also called cold laser therapy, to treat a variety of painful conditions. And with my presentation, I'm looking at the science describing how laser therapy works and which conditions it's effective for helping. So laser has a number of effects on the body. Basically, the laser light penetrates into the tissue and it stimulates light-sensitive receptors in the cells, what we call photobiostimulation. That will increase blood flow. It's a vasodilator. It will increase ATP production in the cell. So basically, it raises the metabolic rate of the tissue. So if you have an injury or a painful area, it helps it heal faster and it helps get rid of the pain. Laser also has an anti-inflammatory effect. It decreases oxidative stress, and it can be used to treat nerves, to have a pain relieving or an analgesic effect. We often use it to treat myofascial trigger points, so basically a painful knot or a tender nodule in a tight band of muscle that the examiner can palpate, and then we apply the laser probe over the area to help get rid of the pain. Laser can also help fracture healing. So in my practice, occasionally I will see a patient who has been in a motor vehicle crash or some other accident and they're suffering from a fracture, such as a fracture of one of the long bones in the hand or the foot. And there is evidence that laser can help stimulate more rapid healing. Now, laser is germane to this conference because rather than a hot laser or a high-powered laser like what one would use to do surgery, we're doing a low-powered laser. So the concept being that laser therapy has a biphasic dose response. At a low dose, it has a stimulatory effect. Where a strong laser could burn tissue or could cause injury, a weak laser helps stimulate healing and getting rid of pain. And there are over 4,000 basic science and clinical studies pertaining to low-level laser therapy that have been published and are available on PubMed, which is the website for the National Library of Medicine. And specifically, what I looked at are randomized controlled trials. So studies where they have a placebo or a control. And I found about 230 randomized controlled trials that were relevant to using laser to treat pain. Now, in my practice, I don't do any dental work, so I didn't look at the studies pertaining to healing and dentistry. But the conditions that I found where there is science supporting low-level laser therapy are TMD or jaw pain, so temporomandibular joint disorder, osteoarthritis, pain in the knees, diabetic neuropathy. Of course, we can't cure neuropathy. It's a leading cause of amputations. It's a terrible condition to have, but at least we can temporarily alleviate the pain using laser. Myofascial pain and fibromyalgia are both able to be effectively treated using low-level laser therapy. Low back pain and or radiculopathy, so pinched nerves, irritated nerves in the lower back from herniated or bulging discs, degenerative disc disease, those conditions respond well to laser therapy. Carpal tunnel syndrome is actually the first condition for which low-level laser therapy was FDA cleared back in 2003. And we can effectively treat carpal tunnel syndrome in many cases using the laser. Other conditions for which there is evidence include tendinopathy, frozen shoulder, or what we call adhesive capsulitis, tension headaches, Raynaud's phenomenon. That's a condition where there's an abnormality with the sympathetic nerves, and the hand will get cold and it will turn red and white and blue because there's not enough blood to the area. And then sports and motor vehicle collision injuries, which is something I see often in my practice. So I have been using laser clinically for about 3 years now, and what we use is an 830 nanometer gallium arsenide laser with 100 milliwatts of power. And basically the laser probe is used to treat an area for about 90 seconds, and we will treat maybe 6 or 8 points per visit depending on the patient's presenting condition. And what I recommend is that laser is beneficial as a physiotherapy modality, particularly as part of a multimodal treatment plan. In other words, a patient comes in, and normally we wouldn't do laser exclusively. We might also do spinal manipulation, different physiotherapy modalities, therapeutic exercise, but laser is a useful modality that is very safe and has no known side effects. So there's no downside to trying this therapy, and it works and it gets good results for most people. Now, there are critics who will say that laser has no benefit or it's no better than a placebo. And looking at the scientific literature, what we can find is that in some of these studies that show no benefit, there is a flaw in the methodology, or perhaps the dose or the treatment parameters are not optimal. In other words, they may have undertreated, they may have overtreated, and I would add that additionally, laser is dependent on the skill and experience of the operator. So taking the example of a fracture in the hand, one would have to irradiate the area of the fracture, or the laser is not going to be effective. Or a myofascial trigger point, the clinician has to be able to examine the patient and find the right spot to put the laser, or it's not likely to do any good. So in my experience, there's no downside to using laser as another tool that we can offer patients that are suffering from neuromusculoskeletal pain. And in many cases, it enables us to help people who haven't got adequate relief from anything else. In my practice, I've had patients with failed spinal surgery who have responded favorably to the laser. And with diabetic neuropathy, there just isn't much out there that gets those patients relief. And now that I have incorporated the low-level laser therapy into my practice, we can help a lot of those people to at least get some temporary relief of their pain.